So walking is today's topic. Babies are supposed to start walking sometime between 9 and 15 months, and that's pretty much what we see in most of our patients. My name is Dr. Noha Polack. I'm a pediatrician. I've been practicing pediatrics in Union City and Bayonne, New Jersey since 1996 at Progressive Pediatrics. And today I am joined by Dr. Giselle Tadros.
Hello, everybody. My name is Dr. Giselle Tadros. I've been a pediatric physical therapist for 21 years, and I own the practice of in-home pediatric PT. We service kids in their homes in New Jersey and parts of New York.
Awesome. So Dr. Tadros, let's talk about walking. I love to see kids when they start to become mobile because, boy, they become fun and trouble also. Let's talk about the progression. In terms of walking. When should parents notice that the babies are starting to walk, and what should they watch out for?
I love that you talked about progression because that's sort of what we look for, and that can be sort of part of those red flags of understanding why a baby is walking a little bit later. In a very general sense, I would love to see a baby crawl around 9 months old, and I usually, in terms of timeline, would say 4 months between walking and crawling. Between crawling and walking. So if your baby crawled at around 9 months, you're going to be looking for crawling to happen between 12 and 13 months. And that's sort of how we calculate it in the PT world. You want to see signs of readiness to walk. So you want to see them attempting to crawl up the stairs, pull up to stand, start cruising along those higher level surfaces, bending to pick things up off the floor without falling back on their bum, and staying in that upright position. Sometimes you want to see also them lifting their hands, using one hand to hold on and the other hand to play. And those are signs that they're gaining the confidence, gaining the balance, gaining the strength to start that walking. So that progression is really important to see. I've heard in the past that pediatricians will wait up to 18 months to see a baby walking. And for me, as a pediatric physical therapist, that's just too long to wait. There's so many things that we can do to intervene at that younger age that waiting a little bit longer can really just make it harder for the parents and for the baby. And just getting that desired movement that we want to see.
Exactly. So if I see a baby in the practice, we always assess development at every single well visit. And if I see a baby in the practice whose, muscle tone is a little bit less than I expect, and if they're not at least, crawling and trying to stand by, 9 to 10 months of age, I get a little bit concerned. And I usually advise parents as to, allow the baby more floor time, allow this, allow that. And we talk a lot about it. But one of my pet peeves, to be honest, is using too many devices to help babies move. So I'd like to discuss that for a moment. The American Academy of Pediatrics and my 25 years experience says, do not use walkers. Please do not use walkers. They're not safe. They do not help make your baby walk better or faster. So what's your point of view, Dr. Tadros, about devices?
Yes, so containers in general, I'm a big advocate to stay away from. It's okay to use in moderation. 10, 15 minutes a day is okay without having concern. But when you start using all these containers to hold your baby, it actually prevents their muscles from working and the brain from using the muscles to understand how to move. So floor time, as you said, is number one. Allowing a baby a safe and inviting place to play on the floor where they can do it without getting hurt is obviously the best. We understand that sometimes you have to empty the dishwasher or, go to the bathroom, take a shower, and there's no one to watch your baby. So it's okay to use some containers such as, I'm not even a big fan of any of them really, to be honest. I do want to distinguish though between those walkers that you were talking about. The ones that are deemed unsafe are the ones that have wheels where you sit your baby in them and they kind of move on their tippy toes and they go forward. Those are the ones that are unsafe. I was telling you earlier that they're actually outlawed in most countries because they are dangerous. They have hurt babies. Babies have died in them, and I don't like to scare you, but just so you know, those are just a big no for me. The ones that have the wheels. The push toys are the ones that sort of the baby can hold on to and push, kind of like a wagon. Those are okay if you find that their baby is maintaining an upright position. But again, they need to be used with supervision. So you're not going to allow them to use it anywhere near stairs because they can fall, obviously. And sometimes around that 12-month mark, I do ask parents to remove those push walkers out of their play space because they do sort of become a crutch and get in the way of their bodies learning that balance and core stability that they need to take those steps.
Perfect. I totally agree. So if you need to contain your baby temporarily, the best place is in the crib. So put the baby in the crib safely while you're trying to take a shower or cook a meal. Those exercisers or jumpers where the kid can be jumping, I don't love them either, to be honest. They're not wonderful. But if you need to put the baby somewhere, it is better than using the walkers or any other devices.
Yeah, just using them in moderation. Like I said, 10 to 15 minutes a day for those like times that you really need to contain the baby. But I love the idea of using a crib. Back in the day, we used to have those big play pens. So now I say buy a gate and just like sort of wean off some space that they can use to play safely. They can pull up and they can cruise and do all those things in that nice secure area.
Right. So walking between 9 and 15 months is what we're hoping for. We're hoping that the baby gets lots of free time on the floor in a safe way to move, explore, and get strong, because that's what they need. They need space to get strong, right? Yep.
Absolutely.
Yep. And again, we will assess their growth, their development, their motor skills, their physical exam, everything at every well visit at Progressive Pediatrics. So every pediatrician is going to do that for you, and make sure you ask the questions about walking.
Excellent. And then I just want to add that physical therapy is fun for babies and kids that are learning to walk. It's really just playing and allowing them to, every time they bend to pick something up, that's a squat. And so we get them to strengthen their muscles and teach the muscles how to walk in like a very low stress environment. So I don't want parents to be afraid if they need like 1 or 2 visits of therapy, because a physical therapist can quickly identify what's going on. Is there a lack of strength? Is it just a lack of confidence? Is there a balance issue? And we can give you exercises to target that to allow the walking. So 1 to 2 sessions of therapy is always a great way to sort of get over that hump.
Perfect. Perfect. Thank you for that message. It's been great talking to you today. Again, I'm Dr. Noha Polack. I'm a pediatrician in Union City and Bayonne, New Jersey. I've been practicing pediatrics at Progressive Pediatrics for 25 years. Don't hesitate to call us if you need anything for your children.
And you can find me at www.inhomepediatricpt.com or on Instagram or Facebook under that same handle, inhomepediatricpt.com.
Oh, that
Thank
reminds
you so
me.
much.
Your Instagram stuff, the stories you have, so informational. I love her Instagrams because I learn from them. So go ahead, go on there.
Thank you. Thank you so much.
Bye.
Take care.